as we think about what can we do with the U.S. healthcare system, the first view I would suggest is to think about it through the eyes of the customer. And the eyes of the customer means that things like low acuity care can be delivered with telehealth. It means that walk-in urgent care clinics can become a significant part of low acuity care for people needing to actually get a flu shot or actually see a doctor for a face-to-face visit. And these new types of consumer-centric services are rapidly being adopted across the country and will only get larger as time goes on, just as things like ATM machines and electronic banking became prevalent mainstream systems, and yet 30 years ago they were just novelties. But more importantly is how do you disrupt a system which has not really taken advantage of new innovations in the delivery of healthcare services. The investment, remember I said, was in better medicine, but not necessarily in better, cheaper, faster ways to deliver healthcare services. And so as we look at the ways to deliver healthcare services, we see that finally doctors are starting to be adopters of technology because they're using smartphones, they're using tablet computers, they're getting comfortable with that. Finally, health records are starting to be digitized, and electronic medical records, while there's no clear standard yet with one particular system, there's still maybe 4 or 5 electronic medical record systems, that over time we can see that there is going to be interoperability between these systems. And we know that the end game for so much of healthcare delivery is going to be the fee reimbursement will eventually start to transition to what is called outcomes-based healthcare, which means that if you're going to have healthcare based on customer satisfaction and doctor approval that the procedures have been able to achieve what they wanted, you've got to be able to measure things. And so we go back to the big revolutions in technology, what I call the tsunami of technology innovations, where we have the affordability of cloud computing, which the simple way to think about it is it's becoming a utility. You couldn't imagine having a home without electricity. It's going to be very typical in the near future that you won't be able to imagine your life without being able to plug into a utility called information. And information will be available in the cloud, and it'll be a commodity type capability that will be available to all different kinds of businesses on an affordable basis. So it's not the technology that's the value, it's what information do you keep and what do you do with that information. So very affordable, massive amounts of computational and storage capacity on the cloud. We talked about the Internet of Things and how there will be literally tens of billions of sensor-based devices, basically mean machine to machine, again connecting back into the cloud computing, and then finally moving into unstructured data. And unstructured data, if we take it into the medical field, is things like there are approximately 26,000 genes in a human being, but you can not only personalize the human genes down to the individual, but you can also start to do correlation with the proteins of each individual using sensors which can track up to 2 million proteins of an individual in real time. And so now you combine the data analytics of being able to look at 26,000 genes and 2 million proteins individualized for each person, and you have the chance to do two things. One is you can do population studies and be able to look at people with groups of certain characteristics and be able to study them longitudinally over time. That's very insightful for medical science, but more specifically for the individual patient as we move to what's called the quantified self and to patient-centric medicine, we'll be able to use sensors. Some will be worn on the body, some will slightly penetrate the body, and for instance, capturing slightly below the skin, you can oxygenate to the skin and capture almost everything you could from a blood sample and do this in real time. Or some sensors will actually be able to be swallowed like a pill. So the technology is not something that I need to spend much time on because there's so much innovation going on in the technology. I'm more interested in focusing on what are the implications of sensor-based technologies, unstructured data, as you might capture with genes and proteins, and being able to look at that in terms of predictability of different types of health outcomes for individuals. For example, with high-risk patients, they're in the chronic care world, about 5% of the population represents 47% of the U.S. health spend. Imagine if you can start to monitor those patients and be able to predict when a medical event based on probability statistics, when an event might occur based on the particular conditions that patient has with their proteins or with their genes, at that moment in time, and you're monitoring that, of course, in real time. So the opportunities to give the policymakers of healthcare dramatically different tools to measure outcomes, to give the private sector an opportunity to bring in true innovation in data systems. I'm talking about big data analytics, and be able then to get it adopted in our health system. And the health system is starting to change dramatically as employers become self-insured, and they have much more flexibility in what they determine to do, both for wellness and for sick care of their risk pool, which is their employees and their families, than the politicians do when they're dealing with programs for the general public.